All right. So sorry about the change of plans. We had some issues today at home. I had to stay around here. I hopefully not going to take a whole bunch of your time. I just wanted to make sure I let you know what to expect for the remaining of the semester, how it's going to work. It's going to be pretty repetitive each week, so that should be good and bad, I guess. I also want to make sure I talk again about the project and the group project, what to expect with that and how to work that, and what the requirements for that are going to be. Before I get started with anything, are there any questions as far as in housekeeping with how the semester works? Don't take any questions on anything. Okay. So far, we've finished the first section, which I call the review section, so that we all are on the same page as far as our exercise science knowledge, exercise guidelines, and everything else we talked about. And now I want you to imagine, as we move forward, that now you're working in the field and you're learning, maybe you're working with clients, you're getting new clients, and you're learning about individuals that may have that special, be part of that special population that we're covering. So that's how I frame it. As you look through each of the special populations, we're going to cover them in the same fashion. I'm going to describe to you what it is. So I'm going to define it for you, how we talk about what that is, how often it happens in the population, how prevalent it is. So it's something common, you see some numbers. How likely are you to encounter someone that has this disease or condition? And then we'll talk about what are the differences physiologically. If it's a disease, we'll talk about the pathophysiology, if it's a disease. So what's wrong with them? What systems are impacted of the body? The first one we're going to talk about is obesity. So we'll talk about all the systems of the body that are affected by having this disease. And then we talk about, well, what does that mean to the exercise guidelines? How do we have to modify the exercise guidelines to make sure that exercise remains safe and effective? So then we talk about what we call special considerations for exercise. Then we talk about exercise recommendations for that population. Excuse me here. Cats. What are the special exercise recommendations for that population to help them alleviate some of the signs and symptoms of their condition. I usually give you some research that are associated with that. So any scholarly articles on the topic. You also will see some videos about the population, maybe hopefully something you have not seen before. And so guess what? That's exactly how I want you to frame your research presentation. So you'll be covering in a shorter amount of time, but you will be covering exactly all the same items. You'll be doing it the same way. So with that said, let me share my screen here. Any questions on that so far? Chat or voice, whichever. Okay. And I'm gonna I always do this one. Okay. All right. Let me move this over here. Maybe that's better. Okay. Can you guys see my screen? Somebody speak up.
Yes.
Okay,
Yes.
perfect. Okay. All right. So today's February 9th. Here's where all the presentation information is. I just want to guide us back to the schedule, so what we've covered so far, and make sure we're on the right page, on the same page. So by now we finished all of the work here. So you should have completed all of that. If you're in this class right now, you probably already have done all those things. There's only a few of you that haven't. We're going to start this week. You should do, so how to prepare yourself this week. Make sure you go through the module on obesity. I give you a little brief overview about what it is. There's a PowerPoint on there, which I'll show you in a minute with a voiceover. In order to hear the PowerPoint, you have to download it. Don't forget that. If you don't download it, you won't be able to hear it if you're just trying to do it through web courses. You should read, here are the pages in your textbook that I want you to read. So you should complete your reading. Once you feel, if I assigned any articles or if I assigned any extra videos for you to watch, Make sure you've done all of those, and all of those are contained within your module. Then take one of the quiz attempts, at least by this week. And then after you're ready with all that, then you're gonna take a look at the case study. And every week from now on, it's gonna be a case study based on the special population that we're covering. So for this Friday at 11:59 p.m., the obesity case study, your initial thoughts, and it should be based on the information that we've covered. If you're using outside information, make sure you reference and cite your work. So no cutting and pasting, anything like that. It should be your own individual work, and if you do use information that's not yours, make sure you give credit for that. But primarily, I want you to use the information that we covered in the textbook, in the PowerPoints, and the other reading assignments. If I give you some research articles, you could use some of that to answer or to come up with your answers as far as how you would deal with that particular case study or situation that I present to you. So your initial post would be due this Friday, and then you have until next week, Friday, to reply to your classmates, to your groupmates, on their comments that they posted about obesity. And this is all within your small groups. So as we go through this section, we'll have 4. We're going to talk about obesity, diabetes, pulmonary, and cardiovascular. Each week will look the same. And then we'll take a second exam, which will be on exercise and illnesses. It will cover the 4 different special populations that we covered in this section too. Okay, so it's going to be pretty repetitive every week. If you look at it as a quiz, a case study, a quiz, and a case study. And of course, you have to go back and finish your replies if you haven't done them. So that's going to be pretty repetitive from now on. When we get to the next section, you'll have 3 different things, 3 different populations to talk about. So that's what to expect from now on. Every week, a quiz, a case study, and module by module, we're going to get through it that way. Okay, so I take some time to make the schedule because, again, sometimes the reminders on workforces, it depends on the browsers that you use, and they do not always pop up so that you can see them. So input all these days into your calendar, into your phone, and get reminders that way. That's the safest way to go about it. And of course, I try to remind you every week of what's up and what's due. Okay, so let's go to the home, and actually I'm going to go to the modules. And now you should have section 2 for everyone. Section 2 should open now. So if it's not opening for you, it might be that you have not clicked on something in the previous module. So everyone should have access to everything in section 2 now. So for example, if you go, this presentation has a voiceover. Takes a minute to load because it's got a lot of stuff in it. When you see this, that means that it's a recording. So here, it will not play. It will not play in workforces at all. In order to listen to it, it has to be through the PowerPoint. What's it called? Not app. Oh, I can't think of it. Software, I guess. and then it will play, and you can play it as a slideshow, or you can click on this on your PowerPoint slide, and it will play my voice over it. Okay. So you make sure you do that, otherwise it's just a PowerPoint and you won't be able to listen to it. But let's look at your first case study I presented to you here. I think maybe there's some differences in here from what you have, but just to get the general idea. What I want you to do again is after you've read all the information, so don't feel like you need to get able to answer this now, although you might have an idea on some of these questions. The goal is for you to be able to answer it after you've covered all the information. And if you did fitness and weight management already, you maybe have a pretty good idea of which way to go with this. So again, put yourself in the situation. You're a personal trainer, exercise physiologist. Now you have this new client, Colin. He's 29 years old, sedentary. So you have to understand what that sedentary means. Hopefully from our last screening and good activity screening, you have a better definition of that. He came for his initial appointment with you. So you have his height and weight. So you should be able to do something with that information or know what to do with that. He is disease-free, so you should know what that means as far as preoperative screening, and asymptomatic. What's asymptomatic? Who cares to jump in and tell me what that means?
A person that doesn't show any symptoms.
Yes, a person that doesn't have any signs and symptoms of whatever it is. In this case, a CMR. What did we say CMR is?
Cardiovascular, metabolic, or renal.
Renal disease. Perfect, exactly right. So, so now we have more information about him there too, right? That we can use for our medical, exciting things, medical clearance. So, and then here's some, usually when someone comes at the beginning, we can do, even if we don't think they're ready for an assessment, we can do what I call resting tests, where we could take their blood pressure, we could take the resting heart rate, pretty much like nurses do before you ever see the doctor when you go to the doctor's office. I was just at the dentist last week and they did my blood pressure now and my temperature. I don't know, maybe it was my age, but we don't talk about that. But, so yeah, it's a test that these tests can be done by most healthcare providers. They're non-invasive, they're resting tests. So you might have done this with the slide. So in this case, his blood pressure was 130/90, resting heart rate was 80. So just to get some feedback, to give you some information about him. And so when you look at this, I want you to answer 5 questions.
Professor?
Yes.
The screen I see is blue and it has like your email. It's not the web courses or or your PowerPoints.
Is that true for everybody else?
Yeah.
Okay,
yes.
Somebody, well, good that you said something. It's weird because it's the same web courses, so I guess every time I switch pages, I have to. Okay, well, let me see that. Let me go back to my desktop share. Where did that go? Let's try another page. Okay. Okay, I know what happened. I know what I did. I have 2 screens, and so I must have moved it to the other screen. It was user error. Okay. Let me try that again. Okay, so can you see my screen now?
Yeah, thank you.
Okay, let's see. How about now?
Yep.
Yep, okay, all right. That's, I'll have to do it there. Okay. So you probably didn't see, did you see the schedule when I was on it?
Nah, we didn't.
You didn't see it. Oh, nobody spoke up, huh? Okay. Well, at least maybe you heard me. So what I was on before was this, showing you what was up this week. So this week you have a quiz, you have the initial post, and then it's going to repeat every week the same thing. So that's why I wanted you to see the schedule. So it's going to be pretty repetitive every week. And all the pages that you got to read are listed here because I'm not covering entirely all the chapters. as I've done before. So it's going to be specific pages because some of those chapters have more than one population. Okay, so now let's go to modules and see how this works. Can you see this? Can you see the modules pages?
Yeah.
Okay. So you should be able to see everything that's on your, something changed here. So are you, wait, what happened here? All sorts of issues today. It's not my day. Okay. Oh, I know what happened. Okay. Oh, goodness. Let me try it again. I need to wake up today and start over. Patience. Okay. Okay. Can you now see your module 4, obesity? Can you see that now?
Yes.
Yes, okay, so you see module, okay, perfect. So here you will see again, I talk a little bit about what to expect in this section. Then I talk about obesity and give you some information about it in writing. So it kind of looks like a write-up like this. Okay, you can read the highlights here. Basically, that's what this is the highlights of you will find. It's like your PowerPoints right now. A lot of it is, that's what this is. Since we have some students that prefer it this way. And then you have the voiceover presentation. Okay. And then we were looking at the case study. And so what I was talking about when you couldn't see is this little speaker that you have here. You will not be able to listen to it or click on it and do anything on web courses. You have to download the PowerPoint slides in order to be able to click on it and play it. And so you can either play the entire PowerPoint as a slideshow and hear me, or you can play each individual slide and then hear me. So we're looking at Colin here. Now this is what your case study looks like for this week. And you've heard some of the explanations already. And so you have 5 questions. How would you start? Does it need medical clearance? And yes, this is a little bit of what we talked about in section 1. You will need that information still. So although I don't do a cumulative test, we will be using that information that you learned in the first section to work through all of these special populations. So that's why I covered it. So you will need that. You have to calculate his BMI. You have to figure out how you would write a SMART goal. We talked about that again also in chapter 2. And so you want to write a SMART goal based on picking something that works for him. And so you need to know a little bit of background information as far as what are the best goals for someone like Colin that has obesity. So you do have to go through the PowerPoint and the reading assignments before you will answer this correctly. Because the goals, we're not pulling them out of thin air. There's actually recommendations for what the goal should be for someone that fits Colin's background. So really important. What special considerations for exercise would you make? Again, this should come not just for your general knowledge, but from the reading assignments and from the textbook and from the PowerPoints. Okay. And then the last one is asking a little bit how you would motivate Colin. And again, that also comes from listening to the PowerPoints and your reading assignments. So I put it up here just to show you that this is something, the case study is the very, very last thing that you should complete after covering everything in a module. So not the first thing, I put it here just to let you think about it as you go through the information, but the last thing, because now you're gonna apply everything that you learn in the module to an actual situation or scenario or individual's problem. Okay, so that's how I want you to prepare. So don't just jump right into the case study first and try to do it. I suggest that you look at it every time, look at it first, so that you have that in the back of your mind. But when you actually answered it, you already gone through all of the materials that I've given to you, that I've asked you to review. That is the best way to do it. So you will post your initial comments, and then your classmates can respond back to you. And every Friday, this Friday you will do your initial comments first. By this Friday, you can do it sooner, and then your roommates can answer you as far as their comments on what to expect. And if you look through the PowerPoints, you'll see that it's going to be very similar to what I want you to do for your project. I define what it is, talk about how you find out who has obesity, by what criteria. And so I go through a whole bunch of different statistics, studies, just like I want you to do. We talk about physiological differences. Yes, this is a fun. I have fun doing this one. Based on what causes it, managing weight. We took my things on weight management again. Some of the stuff should be repetition, physiological difference. This one is really gives you a picture of what's going on. So in the same kind of format that I want you to do is see what are the effects in the cardiovascular system over here, musculoskeletal system, respiratory system, digestive system. And again, for some diseases, it's not going to affect every system, but obesity is one that affects many of them. So, I mean, if you have somebody with asthma, well, it's going to affect the respiratory system primarily. So that's how this usually works. But with obesity affects a lot of systems. Then we talk about what to consider for exercise. What are the do's and don'ts? What are particular things that we need to think about? All of that's covered here. And then what are the exercise recommendations? Okay, so based on that, what do we recommend? What are going to be our priorities? Is it going to be cardiovascular exercise? Is it going to be strength training? Is it going to be flexibility? What are the priorities? What should be our focus? And that's what exercise recommendations are. Recommendations are like when you go to the doctor and they give you a prescription. They actually write something out. Do this 2 to 3 times, or take this pill two times a day for 2 weeks. But what's your prescription for exercise for each person? That's what exercise recommendations are. Special considerations are the do's and don'ts. Well, try not to do high impact activities. Maybe wear proper footwear. Be careful of the size of the equipment. What about body weight exercises? That's special considerations. Exercise recommendations, think of it as a prescription. Exercise is a prescription. So that's really important. I usually also assign for you some videos, or some other, here's the case study again. If you go to the modules, you'll see that in this one I'll have other videos that I want you to see. This one, how fat kills, okay? And then some papers that are important, scholarly articles or recommendations from, this one is from the dietitians group. It's the latest one that they did, the Dietetics Association, and then this one is from ACSM. So you'll find that to be true for all the other ones as we go along. I'll show you some videos. I may have some articles I want you to read, and it'll move along just like that from now on, okay? Any questions on that? What's to be expected in the next 4 weeks? Okay.
Yes, where do we submit the case studies?
Can you say that a little bit louder? I didn't hear you.
Sorry. Where do we submit the case studies?
It should be right with the assignment. So if you click on the assignment, I haven't opened it up yet, I think, because I wanted to talk to you first. Let me see.
Oh, okay, no problem. I just wanted to make sure. Thank you.
Let me see. Yeah, I haven't opened it up yet because I wanted you not to try it yet. So I'm going to open it after we have class today. So I'm going to make sure that you understood what I wanted you to do with that and how I wanted you to do it. So I will open that up, but they will then after now, they will open as soon as the module opens with all of that. So you have time to get a little bit ahead. So now let's go to the research. We should be thinking about that now. If we look ahead for the schedule again, which you see that PowerPoints will be due at the end of March, March 29. So you should be starting to work with your group. As I said before, I want you to work with your group within web courses so that I can see your interactions, your professionalism, your ethical behavior, your teamwork, all of that stuff. So if you go to GroupMe or anything else like that, I don't get to, I can't assess it. So I'd like you to keep it here. So you're gonna use this discussion board, and it's just within your group to talk to each other about the project. And make, you know, you need to make dates to do a Zoom meeting or anything else, work meeting, whatever you're gonna do. You should keep all your conversations within web courses. Otherwise, if you do it outside, I have very little way of gauging your group activity. So that's the best way to do it. As far as the research project, again, you see that you find a lot of similarity between the way that I organize, so I'll give you a lot more information that I'm asking you to submit, and the way I order our presentations with what I want you to work on. So as you start to decide which assignment of duties is coming up, what does that mean? Well, this is what needs to be completed. A title page, you have to describe the special population. So somebody can come up with, you know, doing, usually these two work together, or these three, right? Because the description may not take a long time to do, it's one slide maybe. And then find how prevalent is in the population, whatever, if you have spinal cord injuries. Can you find some charts and graphs? Is there that you can share as far as who is most affected, you know, like demographics? Is it Hispanic cord injuries? Is it mostly males, females? What's the age group? Things like that will fall into that's most affected. All of that falls into statistics. And so maybe somebody can work on those things, right? Physiological differences, like I showed you for obesity, for example, what systems of the body are affected primarily, and what are those differences? What happens as a result of having this condition, right? So that in this one, I want you to stick to not to go too deep into the weeds with medical information, because that could be very in depth, especially with certain populations. But just maybe a couple of slides on what are the physiological differences. So, and then you would have, everything should be referenced, right? The first place to go for information on the special population is your textbook. So your textbook actually covers the special population I assigned to you. So in that section, you should find references that you can pull up and use those to add to your presentation as a starting ground. Those references that you pull up could have other references, so that's the best way to do it. So everything should be, this is a research presentation, so it should not just be your thoughts, and they should be backed up by evidence, because that's the field we're in. Then someone can talk about, for some populations, certain groups may already have put out what they call a position stand or special consideration paper. ACSM does a lot of those. So you can look to see if there's anything that's been put out about things to think about when working with your population. Exercise recommendations, then again, what's going to be a priority? If you're working with someone that's post-stroke, maybe priorities are going to be more neuromuscular types of exercise. Neuromotor training may be a priority. So that's where we're going to get that. And for some populations, there may not be a lot written, but your textbook, again, will give you an idea of where to go to look for these recommendations and priorities. Then this section, which sometimes gets confused, you're going to actually look for studies that have looked at your special population and exercise. So not medical literature, not psychological literature, exercise science literature that has looked at, again, it says spinal cord injuries before, so spinal cord injuries and strength training, spinal cord injuries and the benefits of exercise. So it has to be related to exercise, a research peer-reviewed study. Peer-reviewed meaning that it's in a journal. You need to find 4 to discuss in your paper. The best way students have done it is, it looks like an abstract, right? And it's 1 study per slide, and then you talk about each study. So that's a very, if you look at the rubric down here, that's an area of lots of points. So it has to be, research article has to be 4, so you make sure you cover everything. If not all the articles are about exercising your special population, you're gonna lose points. If you don't do all the articles, you're gonna lose points. So this is an area that needs probably one person, maybe 2 people can work on that. Then here's where you can add additional information to make your lecture fun. So you could have, let's say you have autism, so maybe you direct them to a website that deals, that's an association for autism. Autism Speaks, for example, or let's suppose that it's cardiovascular. I use the American Heart Association. Or if it's diabetes, it's an American Diabetes Association. So you direct people to your audience to those websites and explain them a little bit what they have to offer, what you can learn by visiting those websites. And so the lab, and then it doesn't have to be in this order. You can use them in your presentation however you like. And then maybe a video that highlights someone with spinal cord injuries doing strength training, or talks about their experiences. Anything that makes it more memorable for somebody to remember what this population is all about. And then of course I grade you with things like your presentation, PowerPoint itself, that it's professional. Spelling or grammatical errors is easier to read, and now it's easier because you only have to be able to read it on the screen. In class, when we do it in class, I sit at the very back and have to be able to read it in the very back of the room. So now you have to just be able to read it on your screen, so that's a little bit easier. And then whoever's speaking should be audible, they can be able to hear you and all that. Answering questions, well, that's only if you have an audience. Well, actually you will, because we're actually doing a scheduled time in my online class. People do it different times, but you will have to answer questions from your classmates, and I allow about 5 minutes for that. And everybody will have questions, because when we begin the presentations, I tell everybody that's present that they have to write one question down as the presenters are speaking. And at the end, when they ask, does anybody have any questions? And nobody raises their hand, I'll just pick on someone and say, Donnie, what's your question? So everybody will have questions. So you'll be ready to answer questions, because now you're the expert in this population. So that's what I'm looking for. And the last page of your PowerPoint should be the references, all of them, not just the 4 articles, but all of the references you realize. So where you got your prevalence and statistics, where did you get your special population description? Maybe it was your textbook. You have to cite your textbook. Okay, so any reference that you use that was not your own will be cited in the P style in the reference slide. Okay, and again, if you're not sure about what I want or what I'm looking for each thing, I have the rubric right here. Imagine at the end, one of you classmates, or all of you, should take a look at the rubric and grade yourselves and see how you missed anything. Because I use this to grade you. So you need to do that at the very end, check yourself and see how did we do, and then if you missed something, fix it. So I figured if I did exactly what I want, you give me exactly what I want, and then we're happy because I get exactly what I want. And so it's a lot easier for me to grade, and it's a lot happier place for you to be when you get a better grade. So it works all the way around. I did give you here a sample presentation. Hopefully, I'm going to have to probably share it. Let's see. Okay. You can't see that, right? Can you see
Yeah, we can see it.
You can see it?
Effects of exercise on.
Oh, perfect. What am I doing right now? I just got to keep it on this screen. I think that's when I mess up, when I switch screens. Okay. So this was from a previous semester, and they were nice enough to let me share it. It was an aid. They did a really good job. This was in the classroom too. There was 7 of them, and they all had speaking parts. They all dressed the part. They all worked together with like synchronized fashion. It was pretty good. Here's an example. So this is the depression. They did their description of what it is. Here's the prevalence and statistics. See the nice chart, and it's labeled underneath, cited, because whenever you borrow, they borrowed this one from the Institute of Mental Health, so it's not yours, you need to cite it. So they did a great job of doing that. Okay, same thing here, you know, we have everything labeled, easy to read. I could read this from the back of the room and it was clear, not too busy, just bullet points, so not just like paragraphs of writing, so that was perfect. And then we talk about the physiology, the differences, right? So all covered here. And the job, and the nice chart, and then look, they cited it. Then exercise considerations and prescription, right? So they have that, they put these together here. That's fine. And then the research article. So they did one slide per research article, and they chose to cite it down here. You could also choose to put it up here if you like, the author's names with the date or however else. And so they give you a very brief overview of what the article, what the research article was about. And so they did report like this, and they talked about each one. And the additional resources, and they went through the website and you could go and they talked about what these websites had to offer, what you could learn by visiting these websites, any helpful videos or anything for someone struggling with it, or if you're a provider, anything that you could learn from it. And then they have videos that talk about exercise and depression and individuals going through it. And at the very end, they have their references. Everything that they use is all cited at the very end, even their figures. Okay. So, any questions on that? Any questions on the research project? Let me stop share. I think. Okay. So again, as far as working with your group for the research project, it's important that you keep everything within. I have some stuff on the chat. Okay, so somebody answered that. Okay, good. All right. So as far as your research projects, if you can just, I know you guys like to have chat groups and all that, but the problem with that is that it's great when it works, when everybody contributes and everybody, you can tell me everybody was 100%, but it's not so great when one person doesn't respond. So by keeping it on web courses, they're more accountable because they know I can see what happened, what the interactions were, that the group leader asked a question or whatever, and they never responded. And I can see they never locked in either. So a lot easier to keep everybody honest, and it reduces that social loafing happens sometimes. So that's the best way to deal with the project. So again, at the end of March is when you are going to be turning in your PowerPoint presentations. For this week, what I want you to come up with is who is going to do what. And there's a document there that you will submit that actually says, and you will sign, and if you don't, not together, you can sign like everybody, either using a Google Docs so you can sign a document because it's available online, or you can just take a picture of your signature and paste it to the same document. That you agree that what your duties are going to be. So let's say you're going to have, maybe you're going to take care of doing the prevalence and statistics. And so you say, I'm Anna, I'm doing prevalence and statistics. So you're responsible for gathering all the information, perhaps even working on the slide. Make sure you all have the same template. And that's the easiest way to do it. So that needs to be agreed upon for that next assignment, the assignment of duties, okay? Any questions on the assignment of duties? No? Okay. Good, all right. So I think that, so again, let me know if things are confusing. You still have 2 attempts for your quizzes. So that's the same, but the new thing that we're doing every week is the case studies. So just know by Friday night, this Friday, you need to submit your initial comments for obesity. Again, make sure that the case study is the very last thing you do after you cover the reading, the PowerPoint, everything else I gave you, watch videos and all that stuff, and then you approach it that way. And so if you do that, just remember every week is the same thing. And so that would make it a lot easier, a lot smoother. Our next time that we're supposed to meet is March 2nd, but I can, if there's a need for us to for me to say something, I might call us back, but not mandatory. So I think March 2nd is right before we have our next test. So I like to review the case studies a bit, so you know what I was looking for. Okay, so and also to get to maybe answer any questions that you have about the material for exam 2. So, okay, you guys? All right, well, I will be posting this later if you'd like to refer back to it. Space that I missed, to see if I can edit some of that out. So that's it. I'm sorry I didn't get to see you live today in class. I was really looking forward. I'm still wearing my dress that I was going to wear. But my car had different ideas. So anyway, reach out if you need me, and stay safe, stay healthy, and I'll see you guys next time.
Professor, I got a question.
Yes, sure.
It's not related to anything that we talked about today. It was just a question I had for you. I want to get back to like you know how we got to take care of our resistance training, aerobic training. Well, for the flexibility part, I haven't done yoga in a long time. So since you do so much yoga, like recommend any like person or people out there where you could look at their videos and benefit from those?
Yeah, I would put basic yoga to start off with, and maybe shoot for 15 to 20 minutes. And not stay away from anything that is power or Ashtanga initially. You could start with something like relaxation at the beginning, but I would stick to stuff like that. Message me and I can send you some links.
Okay, I appreciate it. Thank you very much.
Yeah. Okay. Anything else?
Have a good day, Professor. Thank you.
All right, you too. You too. We gotta send in the chat. Bye, you guys. Okay, I'm gonna end the meeting.